enter the room.
Hello,
Hi.
I'm Dr. Idris, one of the junior doctors in the GP surgery. Are you Phyllis Morsi?
Yes, doctor.
Could you confirm your age for me?
I'm 55 years old.
And what may I call you?
You may call me Phyllis.
Nice to meet you, Phyllis. I see that you're here for a follow-up appointment. I will be answering all of your questions. So I would just like to ask you a few questions to put things into context, okay?
Yeah, sure.
I have your test results with me. I will be explaining them to you in just a short while. May I ask you why you had these tests done in the first place?
Doctor, I was feeling very tired for the last 4 months. So I was advised that I should go for these tests to find out the reason.
Okay, Phyllis, could you please tell me more about this tiredness?
It's been for the last 4 months, but I believe that for the last few weeks it has been getting worse and worse.
And did it start suddenly or gradually?
Yeah, it's just gradually worsening. I'm feeling more tired than usual.
Mm-hmm. And have you noticed anything that makes it worse?
No, doctor, it's just happening on its own. It's not related with any work I do.
Okay, what about anything making it better? Does rest make it better?
No, rest also doesn't seem to help. I don't know why.
Mm-hmm. Okay, and is it constant or is it on and off?
Constant.
It's constant, okay. And may I ask, do you think anything could have triggered this tiredness for you?
I don't know. Maybe my depression is making it worse.
Oh, I'm very sorry to hear about that. Phyllis, can you tell me since when have you been diagnosed with depression?
I was diagnosed with depression about 6 months ago.
Mm-hmm. And are you taking anything for it?
Yeah, I was initially started on the counseling stage sessions, and then I was taking citalopram for it. So
Mm-hmm.
I think
Yes.
that there has been some improvement in my mood, but this tiredness is not going.
Okay, Phyllis, I'm sure we can help you out with that. Can you tell me, have you recently increased the dose of citalopram?
Um, no, I'm taking it as it was prescribed.
Okay, that's good to know, Phyllis. And with that, do you have any other symptoms?
No other symptoms, not significant.
No symptoms. Do you have any changes in your weight recently?
No,
Okay, any problems with your muscles, any weakness, any cramps?
no, doctor.
No, okay. And what about any problems with walking, problems with your gait,
No,
any headache, confusion?
no.
No, okay. Any sleepiness, unusual?
No, my sleep pattern has become much better after I'm started on the medicine.
Oh, Phyllis, I'm really glad to hear that. May I ask, have you experienced any side effects of this medicine, citalopram, that you're taking?
Any side effects? No, doctor.
Yes.
No, I
Any
was told
dryness
about
of
any
mouth?
effects. No,
Okay. No. Any sweating, any nausea, vomiting?
no.
No. Okay. So just some general questions about your health, Phyllis. Do you have any long-term medical condition
I have
other than
hypertension,
depression?
so for that I'm taking simvastatin.
Sorry, could you repeat that?
I have raised cholesterol levels. For that I'm taking
Okay.
simvastatin.
Okay. And is that well under control?
What?
Is that well under control?
Yeah, that's well under control.
Okay, I'm glad to know that. And do you have any other medication that you're taking other than citalopram and statins?
No,
Do you have any allergies?
no, doctor.
Anyone in the family with similar kind of condition of mental health or cholesterol?
No.
No. And may I ask what do you do for a living?
I'm a housewife.
Okay. And do you smoke? Do
No,
you drink alcohol?
no.
No. And Phyllis, since this has been going on for a while now, how is it affecting your life, this tiredness?
It's affecting so much that I'm not able to do the usual work at the home.
I'm very sorry to hear about that, Phyllis. And do you have any idea what is causing this for you?
I don't know, doctor. I don't know if it's the side effect of the medication or is it a condition
Hmm.
it's associated with my depression.
Okay, yes, that is a very valid concern, Phyllis. Anything else that you're worried about?
No, doctor. I just want some management for.
Sure, definitely. I will be able to help you today. I would just like to examine you now, okay? I-
Okay.
I'd like to take your blood pressure, heart rate, breathing rate, oxygen levels, temperature. I would like to check your blood pressure while standing and sitting down.
2 minutes remaining.
I would also like to do a physical examination for you. Okay, let me just take a look at this. Okay, thank you for answering my questions and letting me examine you, Phyllis. I have your test results with me. Let me explain those to you. So all of your test results have come back normal, so that's a good thing. There's just one thing that I've noticed, that your sodium levels are a bit low. Are you able to follow me?
I don't know sodium. What is sodium and why in
Yes.
my body?
Sure, let me explain it to you. Sodium is one of the salts in our body, which is there for the important functions. And when it is low, it can cause symptoms such as tiredness, which you are experiencing. Is that clear now?
Okay.
Okay.
Why
So,
is it so, doctor?
Phyllis, yes, unfortunately, it is a rare side effect of the medicine citalopram that you're taking. It can sometimes cause this side effect in some of the people causing low sodium. But since, Phyllis, you are experiencing symptoms of this low sodium, what I would like to do is I would like to refer you to the hospital today so that they can correct the sodium levels for you. Do you think you can do that?
Okay. How they are going to correct the sodium levels?
Yes. So, Phyllis, first of all, I would like you to stop taking the medicine, citalopram. We will be changing it to another one called amitriptyline. And for your sodium, they will be giving you a strong sodium solution, which is called 3% saline, through your veins, and it will be able to correct your sodium. With that, they will keep monitoring your sodium levels to check if it is in the normal range. Okay?
I don't want to switch the medication. This citalopram medicine is really suiting me. I have felt a improvement in my mood.
Phyllis, I can understand that it can be difficult at this time, but since it
Move
is
on to the
causing
next
this,
station.
okay.
Wow, that was beautifully done, Dr. Ushna.
Thank
Yes,
you.
but yeah, I mean, I think data gathering was pretty spot on. You asked all the relevant questions there. I would just say
Oh,
one
thank
thing.
you.
The only thing
Yeah.
that I could actually think of was that you asked the ideas twice. So it just probably took a little
Okay.
bit of years. So in the beginning, also you asked what do you think might be causing this? That's how the depression conversation started. I think it might be because of my
Yeah.
depression.
Yeah, I asked for the trigger. What do you think could have triggered this? And then I asked the idea. Yeah,
Yeah,
that's
so
correct.
I mean, so you kind of did cover that question, but a good
Yes.
job. That was done really well. The only thing that I would
Thank you.
want to say is that you can explain the hypertonic saline 3% saline in a little more than solution with more sodium in it,
Hmm. Got
which
it.
is hypertonic 3% saline. So that's also one again. That's also medical jargon a little bit, right?
Yes, I still have some problems with explaining the medical jargon, so I need to work on that.
Absolutely, absolutely. Yes. So
Yeah.
whenever you have to explain a treatment, you actually want to tell them what the treatment is in the medical
Hmm.
terms as it's said, and follow it up
Hmm.
with a layman explanation of what it means, or what exactly it is. Right? Like
Right.
every time you try to tell them of the entity of what are
Hmm.
you suffering from, so they ought to know what they are suffering from. Even
Hmm.
people who suffer from very fancy conditions like neurofibromatosis or astrocytoma, they actually know what it is, right? They actually know
Yes.
the entity.
Hmm.
They can say the name. Because if they want to do any further research, that is something that is really important. Like, how do they actually uh, what do they search for? right? And then always give them, when your time is running out, try to implement these three things, try to give them leaflets so that they have a better idea of, where to look for information about their disease, right? Try to talk about some safety netting, like in your whole transfer to the hospital. If you see that the tiredness is getting, more, or if you start feeling confused, do let somebody know immediately, right?
Right.
And a follow-up, like once we change the medication, like how to follow. So you
Yes.
mentioned that we switched medication to amitriptyline. So why do you think this tiredness, I mean, why do you think the hyponatremia happens? I mean, do you know why hyponatremia is like, by the way, good job on asking those questions on, the dryness of mouth, any nausea, vomiting. Those are the other side effects as well, right? Those are the more common
Yes.
side effects. So good job on asking that. But why do you think hyponatremia happens?
I actually have no idea about that.
All right, that's okay. So what class of medication is citalopram?
It's an SSRI.
That's good. That's exactly why hyponatremia happens. So the SSRI, that means serotonin, selective serotonin reuptake inhibitor. That means the serotonin strain becomes a little high, and this serotonin triggers the ADH, and the ADH goes and acts in the kidney that prevents any urinary symptom. I mean, urine from being removed. So what you end up having is it's called actually a dilutional hyponatremia. Do you understand? Because the water is not getting eliminated. So the mainstay actually is fluid restriction. Along with that, you also give a hypertonic solution of 3% ether. Right. So I'm actually explaining this to tell you that usually because of the high serotonin is why what triggers the entire mechanism for the hyponatremia to happen. Now, you have prescribed something called amitriptyline. So amitriptyline is TCA, tricyclic, uh, antidepressant, right? So what they do is they actually increase the amount of norepinephrine and serotonin. So there is a chance of this hyponatremia to occur with this medication as well. Do you understand what I'm trying to say? So I actually went into some literature before while I was preparing for this case, and the medication that usually the alternative antidepressants that are actually given instead of an SSRI is something called a SDRI, that is norepinephrine and dopamine reuptake inhibitor. One of the big examples of that is bupropion. Have you heard of that medication?
Yes.
And also, you can also give mirtazapine in this case. So, amitriptyline is a little, I mean, it has a lower risk of hyponatremia, but it's not the first line, alternative for this condition, especially when citalopram is causing the issue. Yeah, does that make sense?
I remember that I watched a video about this case, and in that the mentor said that you would change it to amitriptyline and then slowly change it to mirtazapine, because you can't suddenly start mirtazapine.
Oh, I see. Or else you can also start reducing the dose of citalopram also. That's also something that you can actually do. You can actually give lesser doses. Right, because ultimately the offending agent is basically serotonin that's actually causing all this, right?
Yes.
Because even amitriptyline is also causing the increase of both norepinephrine and serotonin here. So you can also reduce the dose and give it for review. So you can always add another team to actually help you with that, right? You can involve the mental health team to tailor the medication review and further management from there. Yeah. Awesome. All right, I'll just finish marking. I'm sorry, I'll just quickly finish the marking. Yes. Otherwise, I think everything was pretty good. Just that towards the end, you were a little, you lost out on time a little bit. But
rushed in the end.
yeah, but I think your data gathering was pretty spot on. Good job on that.
Thank you. I just have a question. Since we know that the cause is low sodium, will we ask other DDs of tiredness in this scenario?
Yes, yeah. I mean, anything else that can be causing the tiredness.
So we will ask
anything that
we know that it is hyponatremia.
Yeah.
Anything else that could cause hyponatremia or anything else that could cause tiredness?
Actually, ask both. Is the hyponatremia low enough to actually cause the tiredness, or is there anything else that is causing the tiredness? Do you understand?
Right. Okay. Yes.
Right. Awesome. I'm sorry I'm taking so much time in doing this.
No problem. No problem.
So it'd be great if somebody else does also participate, guys. Next time, please try participating. All right. Yep, let's go through the thing. I've been a little rushed towards the end in the interpersonal skills, but let's take a look together. Awesome. I especially like the way you actually came back and asked the question of how is this affect, since you've been having this for a very long time, how has this been impacting your life? That was a very good question, I would have to say. All right, so let's take a look. So covered, identify or confirm name and age, clarify presenting complaint. You mentioned feeling tired. Can you describe what you mean? When did it start? Onset and duration. When did the tiredness start and has it been constant or getting worse? Impact on life. How has the tiredness been affecting your daily routine or the ability to do normal tasks? Explore social associated symptoms. Ask specifically about cough, weight changes, fever, nausea, vomiting, urinary symptoms, right? So that's when you're actually thinking along the lines of what else could be causing the hyponatremia, right? Any head injury, right?
Yes.
Associated symptoms specifically, even sometimes if you actually end up getting, a small cell carcinoma of, the lung, that is one of the paraneoplastic syndrome is basically that. Hyponatremia. Red flags, have you experienced any significant weight loss, coughing of blood, any severe back pain? Elicit medical history, ask about kidney, liver disease, or any heart disease, hypertension, diabetes, any medication, or you can just ask, do you have any medical conditions, like how you asked, it is fine. Medication history, confirm current medication. Are you currently on, Citalopram and simvastatin, correct? Any other medication, right? Depression and mood assessment. How has your mood been since starting Citalopram on a scale of 1 to 10? How are you feeling? Yeah, how is your energy level? So you'll understand that the mood is improved, but the tiredness is still ongoing, right? That's good. Ice. So what do you think might be causing your tiredness? Is there anything you are particularly worried about regarding your health? What are you hoping that you can achieve today? So yeah, always ideas, concerns, and expectations. Do all three, because each of them have its different purpose. And I've written a short blog about that, so I'll post it on the group so that you guys can have a refresher read on it. And lastly, relationship with rest and exercise. Does your tiredness improve with regular exercise? How about after a good night's sleep? Right? Where you are one of it. That's fine. All right, management. Let's take a look. So explain the blood results clearly. You have a lot of blood results. So how do you explain it? Right. So you can mention that we did your tests where we tested to check for the liver and kidney and your blood counts, and they all have come normal. Right. So you can how you explain it was that we did, all the blood results have come normal except for. So explain a little bit about what was tested. Right. Because you give them an overall explanation of the whole blood report. Right? Yes. So all these parameters were tested and all of them have come normal except for, and then go ahead explaining that. Provide clear diagnosis, clearly state that she has hyponatremia. right? Explain the significance of low sodium, emphasize the importance of sodium in the body's function and its link to fatigue. Good job on that. Provisional diagnosis, explain possible link between citalopram and low sodium levels. So basically, when you were taking the history, you're ruling out anything else that could be causing the tiredness, right? So you're thinking of anything else that could be causing the tiredness, anything else that could be causing the hyponatremia. After finding out that there's nothing else causing it, so then you can actually bring about that link, right? So your history taking was actually very well done there. Review citalopram, inform her that citalopram may cause, maybe the cause, and that the dose may be reduced or stopped, right? Propose hospital referral, explain the need for hospital admission, monitor and manage sodium levels. Explain
Right.
treatment in hospital, mention possible treatment with hypertonic saline and fluid restriction under supervision. So mainly it's because of dilutional hyponatremia. You actually have to do fluid restriction in this kind of a case.
Right.
Use shared decision making. Ask what would that be something that you feel comfortable with when discussing the medication changes, right? So she immediately said, no, I'm not happy with that sort of a change. So like, all right, we can bring in the mental health team, and then we can review and tailor a plan that would suit you the best, right?
Right. Hmm.
Patient education, discuss side effects of citalopram and potential side effects of the new medication, whichever that you are planning to give, right? Discuss alternative antidepressants, introduce mirtazapine and bupropion as options with lower risk of hyponatremia. Involve the mental health team to help find a tailored approach that supports both your mental health and physical well-being. Follow up after your sodium levels are corrected. We'll follow up closely to ensure your symptoms improve and adjust your treatment as needed. Safety netting, if you notice any worsening symptoms, confusion, severe headache, or any other concerning signs, please seek medical attention immediately. Right? All right, so
Okay.
universal skills finally. Check understanding. Does that make sense to you? Do you have any questions about what we've discussed? Patient-centered approach, involve the patient in decision-making, active listening, encourage the patient to speak about how tiredness has affected her life. Reassurance, with the right adjustment, we should be able to manage your symptoms, because that was a concern, right? Like my
Yes.
depressions might be coming back. Like we'll make sure that your depression is controlled, given the change in medication or the dosage, but we will make sure that it is under control, right? Manage your symptoms and improve your energy levels. It may take some time, but we'll get there. Acknowledge the feeling, like trust the process, right? Acknowledge feelings. It's understandable to feel fed up with the ongoing tiredness. We work together to find a solution. Clear communication, use simple language to explain medical terms. Empathy. So you could have actually explained the whole blood results, like combining a
Yeah.
few parameters together, saying that we tested for so and so things, and these were normal. However, and you can proceed for that, the rest of it. Empathy and support. I'm really sorry for your loss. So understand why the depression has happened, right? Like
Right.
you could that like extra question, like what was the cause of depression? But that's okay. I mean, that's fine. We're treating what comes after the depression, so that's cool.
Yeah.
All right. So good job, Dr. Usna, and thank you so much, Dr. Sana, for that simulation. That was great. All right.